Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit my playlist. In the playlist, I have provided all the topics so far discussed in a systematic order so that it is quite easy for the study. Now, my dear friends, as we know, we were discussing about autism spectrum disorders. And in the autism spectrum disorders, we have already completed two important disorders. One is autism and another one is Asperger's syndrome. And today we will have the last disease in the autism spectrum disorder, so that is Rett syndrome. Now, what do you mean by Rett syndrome? So Rett syndrome, basically it is a genetic condition. Now basically this is an autosomal dominant condition. This is because of the genetic defects. And mostly and quite interestingly, it only affects the female kids. The incidence of this Rett syndrome is quite rare or nil in case of males, whereas in females it's most commonly seen. And studies suggest that there will be mutation involving the chromosome number 28 in that Q portion. The gene which is named to be which was get affected is MECP2, and another chromosome which is get affected, that is chromosome number 22 P portion, and the gene affected is CDKL5. And similarly, some other genes like natrin GI and GL genes are also get affected. These are the suggestions given from some of the studies. But one thing is very clear, this is most commonly seen in female kids compared to the male kids. What is the hallmark of this disease? As autism spectrum disorder, this comes under the purview of autism spectrum disorder. That means it should have some of the symptoms of autism, isn't it? So there will be lots of social developmental milestones, there will be loss of language developmental milestones, there will be repetition, there will be problem in the eye contact, so there will be problem in the reciprocal conversation. So these things should be there. But what actually happens in case of this Rett syndrome is there will be a period of normal development, and if you ask the mother says that for the first 1 year almost he is absolutely fine and he attained all developmental milestones including social and language. So there will be a period of normal developmental milestones followed by, and thereafter maybe after 6 months or maybe after 1 year, mother noticed that there will be regression of the developmental milestones which is already achieved. Already achieved developmental milestones now start falling down. Okay, so there's a regression of the speech and developmental milestones and the development of the stereotyped hand movements. Later onwards, there is slowly the child starts with the development of stereotyped hand movements. Surprisingly, for the 1 year there is no problem, then the problem starts. Therefore, we call this condition as developmental regression. Now, usually after the age of 1 year, there will be regression of the motor milestones and the language milestones. And later onwards, the other developmental milestones also start regressing. Criteria for the diagnosis, if you want to see, there will be a period of normal development usually for 0 to 6 months, and thereafter 3 months to 3 to 4 years. What actually happens is thereafter there will be decreased head growth. There will be decreased head growth. That means, see, 2 to 3 years, 0 to 2 years, it is considered as a period of maximum head growth, and something unwanted is happening during this period. As a result, the brain is not developing, brain mass is not developing up to the mark, and the patient will have decreased head growth. Now we should remember that Rett syndrome is also one of the most commonest cause for acquired microcephaly. Okay, because of this decreased head growth, there will be microcephaly, but it is acquired after birth. Okay, so this is one of the rare situation. So we should remember this. So loss of purposeful hand movements will be there in between 9 months to 2 years, and the classic stereotypic hand movements start in between 1 to 3 years, and gait is also disturbed, posture is also get disturbed, and dyspraxia means problem in the coordination. Okay, so dyspraxia will be also there. So these are the things. Suppose if you get this set of symptoms where child is normal up to the first 6 months, thereafter the child starts with so many problems and there is microcephaly. Okay, so then there is regression of the developmental milestones including the language and social, and thereafter there is beginning of the purposeful hand movements. Okay, so thereafter stereotyped hand movements start. Then the child is having problem in the gait and walking and posture, etc. So all these set of symptoms, they usually suggest of a Rett syndrome, where there is a regression of the developmental milestones. What are the other abnormalities that can associate with Rett syndrome? There may be seizures, because due to due to this particular genetic cause, so there will be degeneration of the brain tissue, isn't it? Therefore, the regression of the milestones is happening, and also there is microcephaly. So there may be involvement of the gray matter. So therefore, there may be seizures. Then there may be breathing irregularities. Then may be poor weight gain, bruxism. Then sleep disturbances may be there. Then very interestingly, night laughing will be there. Okay, so night laughing will be there. Arrhythmias and some of the swallowing dysfunction may be also there. Now, if you look into the trait of the Rett syndrome, increased incidence of mental retardation, seizures, and acquired microcephaly. So these are the three things. Suppose the child is started with a seizure, child is having gradually increasing mental retardation, along with the child is also developing the microcephaly, then immediately you have to think about the Rett syndrome. Okay, symptoms are different, but trait, when I talk about trait, so these are the important traits, because we may get different types of patients in the OPD. So patient is coming with the seizures. In the meantime, you have also seen that he is having microcephaly, and when you inquire, the microcephaly is after birth. Okay, and in the meantime, the child is also having mental retardation, which is gradually increasing. So when you get such presentation, then you have to doubt about the Rett syndrome. What are the common investigation done? That is MRI. So MRI is usually done. That is decreased cerebral content will be there. So you will have the atrophy, cerebral atrophy features will be there in MRI. And diagnosis is basically with the genetic study and DNA analysis. In the DNA analysis, that is the gene which is I told in the chromosome number 28 and 22, that is MECP, that means methyl CpG binding protein 2. Okay, so specifically if there is a mutation of this particular gene, then it is the cause for Rett syndrome. So far it is now, till today it is now considered as a autosomal dominant condition. So this is all about Rett syndrome, which is a third autosomal spectrum disorder. So with this we have completed the basic information regarding the autism. From the next class onwards, we will see how should be the approach and what best we can do in Ayurveda for autism spectrum disorders. Thank you very much. We will meet again. Don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.